Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. This is episode number 20. It's Friday, May 25th. Today we talk blockchain, what healthcare can take from fintech, and hard-earned wisdom for your healthcare IT startup. This podcast is brought to you by Health Lyrics. Are your strategies constrained by infrastructure or tied in a knot of applications? Break the bonds. Visit healthlyrics.com to schedule your free consult. So my name is Bill Russell, recovering healthcare CIO, writer, and consultant with the previously mentioned Health Lyrics. Before I introduce our guest today, I want to share with the audience an exciting opportunity. We've reached some milestones in the show, and upon reflection, in talking to many of you, we found that the content is relevant and timely. And now what we'd like to do over the next couple of months is get that content into as many current and future healthcare leaders as we can. That's why I'm excited to announce that our sponsor has agreed to give $1,000 for every 100 new YouTube or podcast subscribers over the next 90 days to Hope Builders. Hope Builders provides Orange County's most disadvantaged youth the life skills and job training needed to achieve personal and professional success. I've hired some of these graduates at my previous employer, and their stories are nothing short of amazing. The trajectory that their lives are on as being a part of this program is really exciting, and that's why I'm really excited to be a part of it. I hope you'll join us in sharing the show with your friends and your peers to maximize this opportunity. Okay, so today's guest is one of the brightest minds in data. Hopefully that won't go to his head. A successful health IT entrepreneur who actually saw an exit, one of those rare occurrences in the health tech startup world. My good friend Charlie Lougheed is with us today. Good morning, Charlie. Welcome to the show.
Hey, good morning, Bill. It's good to be here. Thanks.
Wow, you actually got to an exit. That really isn't all that common yet within the health tech world, is it?
Yeah, not as much as it should be. A little surreal, right? And still even today, it's still sinking in. But I think we'll see more of it. I think we're seeing some maturation in the market.
Yeah, so we're starting to see some things
Some technology.
So how long has it been since Explorers, since the exit of Explorers to IBM?
It's been just a little over 3 years. So April of 2015.
Wow.
Yeah,
those were exciting times. I think I was with you at a conference, either the day of or the day after the announcement, and it was really surreal on that day. Your eyes were sort of glazed over, like it. I mean, was that something you were really looking forward to, or just something that just came out of the blue and surprised you?
Well, I think we were growing so fast in 2014 that we recognized that we had to either raise more money so that we could get presence on the coasts, or either go public or do some kind of acquisition that made sense. And the third wasn't what we focused on. It was really how do we continue to do the good stuff that we're doing and grow the business. But IBM came along and kind of late in the game. And in about 9 days, we went from a term sheet to signed agreement to do the acquisition. And that was, you saw me probably the day before HIMSS or the day of HIMSS. So all that happened that weekend before, that Sunday before that was when the close happened. And so at that point, we were all a little exhausted.
Yeah, I would imagine. And the life of the startup. I mean, when we first started off, I think we were at my employer, we were one of the first customers. So I got to see you a fair amount. And then it really ramped up. You were flying all over the country, talking to clients everywhere. So, and that's the point at which you just either need more capital or you need a bigger partner like IBM, I guess.
Yeah. So, but it worked out great, and I'm excited to see how the team's been doing, and really proud of them.
That's great. So let me give people some of your background. You're so co-founder of Explorers. In 2009, served as the president. I'm sorry, I pulled the bio off a website. It was probably written in 2009 because it says you're serving as. So we'll say
no longer.
Yeah, served as president, chief strategy officer, and chief technology officer, True Startup. You also served as the president of Everstream until 2007. Co-founded Everstream in 1999, served as its chief technology officer, executive vice president. Also extensive experience with the financial services industry, having led National City Corporation's Consumer Online Banking Division, as well as position in PNC Financial as Senior Vice President of the online channel for its affluent customer segment. Had been with Everstream since 1999, led the product strategy development initiatives. Prior to joining Everstream, served as Vice President of Electronic Consumer Marketplace Systems at KeyBank National Association. And then it says you're very involved in the community, served as chairman and member of the advisory board of Everstream, also chairman of Galen Foundation, chairman of St. Anne's Technology Group, advisory board member to Genesis Innovations, and you have your bachelor's degree from John Carroll University. That's probably the most I've ever read of somebody's bio. So
I'm feeling pretty old now.
Yeah, I know. Well, the thing I want to really point out is, I mean, you really are the data and technology person as well as an entrepreneur. So, because we're going to dive into we're going to straddle that line today of talking entrepreneurial venture, but we're also going to go into some deep dive in some of the technical areas. All right. So one of the things we like to do with all of our guests is to give them a moment to just tell us what you're excited about or what you're working on today.
Yeah. You mentioned being a recovering CIO. I think I'm a recovering entrepreneur. There's probably a good chance I'll relapse or fall off the wagon here at some point, because I'll probably do at least one more, but I've been taking a break, and it's been kind of nice. Spending a lot of time with my family, just trying to catch up on some time you miss. 2 startups is a big commitment, and I balanced it okay, but there's a lot of stuff I'm again catching up on. My wife Katie and I are about to be empty nesters in the fall, so that's a little surreal. We'll have 3 in college, and we'll have a little chance to do some traveling, going to Europe and Africa later on this year, and have a little fun there. But in terms of my professional life, I'm still staying pretty engaged. I'm doing a bit of advising. Yeah, I kind of go towards the stuff that's disruptive. That's the things that generally be the areas that excite me the most.
You know what, Charlie?
But I tell you, most of my
it actually broke up there for a second. You got to be sort of the robot going. So
okay,
could you hit that again? Just what you're working on?
Yeah, I'll just start from the. I'll start from spending time. Did you hear the part about recovering entrepreneur?
Recovering entrepreneur. Heard about spending time with the family, which is phenomenal, by the way. So you spent 5 years doing Explorers and didn't see the family, and then 3 years of being in the house every day. I know how that goes, and the family's like, "Okay, Dad, when are you going to go back to work?"
That's right. They're like, "What are you doing here? Too many trips to Costco." No, but I think is getting angel investment and advising, and working with some companies that are sort of in traditional spaces, but are looking at this from a disruptive approach, and that's exciting. But I tell you, the thing that I'm spending the most time with, probably 40 to 50 hours a week right now, is this nonprofit called Unify Project. It's really exciting. It's kind of like my Blues Brothers project, where getting the band together on a mission from God, etc. Because there are some people from my past endeavors. So Steve McHale and Sonny Nixon and Aaron Cornell, we're working together on it. We've got some other amazing leaders that I haven't worked with in the past, from healthcare and social services and philanthropy and financial services and education and even government. So it's a really neat endeavor. Our board, we've gotten together. It's all the CEOs from the major organizations, both healthcare and education, and philanthropy and banking from the Cleveland area. And it's an interesting mission. It's essentially, and it's not an easy one, it's fix the economy. The economy's rolling along for a lot of people, but that lot of people really amounts to about the top 10%. The rest are still struggling. And the bifurcation of wealth in the U.S. and the bifurcation of income is continuing to be a pretty big problem. And we think it's going to get even worse, not just for them, but for all of us. And so we started looking at the economy and what just seems to be wrong, right? The U.S. bill spends more than anybody else, as you know, on healthcare, yet we're ranked 28th in life expectancy. We're one of the biggest spenders in education, yet we're 20th in literacy. And in our urban core, less than 10 or 15 to 10% of those kids go off to college or secondary education.
Wow.
We're the most generous country on the planet. We give more to philanthropy than anybody else by far. Yet we are ranked third in poverty among the OECD nations. 50% of the US population makes less than $20 an hour. And if you look at what some of the experts are saying about where they see the economy in 25 years, they project that well over 50% of them, close to 80% in some cases, will be out of a job because of automation and globalization.
Well, now I'm depressed. So what are you going to do about
it? I know. So even more so, we're looking at this saying, okay, what is happening with charity? What's happening with all this? And one of the other things we noticed as we sort of did this walkabout, so we did this in healthcare a while back to see what can we help with. Well, within charity, we also found that there's about $800 million that are literally sitting on the sidelines in these charitable foundations. If you amass all the wealth together, so the Bill and Melinda Gates Foundation, Ford Foundation, Cleveland Foundation, right? And you're wondering why is only 7% of that money going to the people in need? And a lot of it has to do with the fact that in order to maintain those organizations in perpetuity and have them continue to grow year over year, they need to be able to hold back a lot of that money, invest it in usually the stock market or Wall Street. That's their mechanism for return on investment, and that's really their only means of sustenance. So, in addition to just continue to get money piled in. Well, we looked at that and said, why can't there be a return on investment for raising up our population, for helping them participate in the economy and participate in the next economy as this rolls around? And we believe that, if you look at someone who's in poverty today, full subsidy spend, it costs the taxpayer close to $50,000 a year, maybe even a little more in some cases. You turn that around and get someone from a position where they don't have good secondary education and training, you get them into a role in computer science or data sciences or other things, and you flip the scales pretty significantly. You've got someone now who is making a living wage. They're throwing off tax revenue. And so we think there's a really big ROI, and we think there are mechanisms to return that ROI. But it's going to take an operating system. And what Unified Project is doing is implementing an operating system. We're building it. And it takes visibility and transparency to data, just like it did in healthcare. It's going to take some AI and machine learning to understand all this big data and trim out the biases. And we believe it's going to take a piece of blockchain as well, particularly around smart ability to sort of bend behavior and performance and think around performance, and ultimately engage those entities that can return investment back to those foundations, back to those investors in social good, and actually bring more money into the system. So, what we're trying to do is bring about an operating system that begins to change the dynamic and bend the curve away from the dangerous position it's going in right now. So I'm pretty excited about it, the opportunity, and it's I think it's an opportunity for healthcare, financial services, and technology to really do a good thing, as opposed to always sort of be blamed for the things of the past and be concerned about the things of the future. I think there's more positivity in front of us than anything, and it's just a matter of grasping that.
Wow, that's exciting. I'm looking forward to following that and seeing how that progresses for you guys. I know with the smart people that you've put together, the solution's going to be pretty exciting. So let's jump into the show. So we have 3 sections: in the news, sound bites, and then the social media close. And I'll kick us off. We each have a story. My story is given your background and the show. So why healthcare should study up lessons learned from fintech. There's a story from healthitanalytics.com. Let me kick it off here. So, from the story, clinical quality, patient safety, and long-term outcomes will always be a top priority for healthcare providers and payers. But the consumer experience is or should be running very close second for stakeholders across the industry. Soaring out-of-pocket costs for patients are leading to choosier consumers who are considering more than proximity to the local hospital when making decisions about where to seek care. Federal efforts around transparency, availability of your data and whatnot are making consumers out of patients, and growing expectations that digital services for payments, communications, and price comparisons will simply be available is putting the squeeze on providers who haven't yet invested in online consumer relationship tools. So nothing new there. We've been hearing this for several years. Then they go into some numbers. 88% of patients want to be able to pay their insurance bills digitally. 68% would like to be able to clear their balances with their provider by using online tools. Yet 77% of providers are still using paper billing statements to conduct at least some of their financial transactions. In 2017, only 4% of practice leaders expressed any interest in the digital bill pay options, according to the survey. This mismatch doesn't just indicate an opportunity for digital payment companies to fill a clear need. It also exposes a worrying disconnect between how providers view their existing processes and what their patients really want to experience. Earlier in 2018, a poll by NTT Data Services pointed out that 59% of patients want their healthcare experiences to align with what they're offered in retail. Half of patients said they would consider leaving their current providers if they found another option that offered more technology tools. Okay, so let's stop there. We'll come back to the story, but the first question I want to bat around with you is, let's do this on a scale of 1 to 10. 1 being the patient has choice. Actually, 1 being the patient has no choice, they're locked in, and 10 being the patient is a full-blown consumer of healthcare with choice. Where do you think we're at on that continuum today?
I think we're probably closer to 0 was the no choice. Is that right?
one is the no choice, and 10.
1 is no 0. No, I think we're probably close to 3 or 4. But I think the attitudes are changing a lot, and we see it everywhere. And I think healthcare just takes a little longer to catch up, right? But I think what's happening in other spaces is going to begin to have a profound impact on the attitudes people have at healthcare. I mean, clearly, the high deductible was a shock to the system for a lot of people. Is it related to cost? Like, wow, I'm paying a lot out of my pocket, so I'm going to make some different choices about this now. But I think other things. I mean, here's something that's completely unrelated but related, Bill. Take the gig economy, right? Uber and Airbnb and other things. People are thinking differently about things they never would before, right? That you'd have some stranger drive you around, or you'd stay in some stranger's house. That wasn't something we really considered 20 years ago, or even 10 years ago. Right. That's changing, and you're even beginning to see some interesting, innovative companies like Nomad and Hire, who are bringing some of the giggy economy to healthcare, particularly around a $15 billion a year market for locum, temporary physicians or practitioners. So I think the age of having a single dimensional channel to healthcare are going to change. I think you've got the other factors of all these baby boomers who have grown up around technology. They've been pretty avid adopters of technology. Will look at this and say, paying my bills should be easier. It should be more straightforward. Getting care when I want it, where I want it, at the edge, should be easier. And I think they'll move towards organizations and provider systems that are progressive in that matter.
Right. My son had to go to, my son's 20-something years old and works for a large company. And he cut his finger, had to get stitches. He went over to the emergency care. And I happened to be available, so we went over so we could just hang out and whatnot. And as they're stitching him up and whatnot, they're handing him stuff like, "Here's your gauze, here's your stuff." And they walk out of the room, and he looks at me and goes, "Am I paying for this? Because I don't really want it." I'm like, yeah. I don't think you have a choice. So, as I look at this, there's really two directions this can go: single payer or market driven. And I agree with you today. It's really neither. You have trends that happen. It was heading towards single payer. Now it's heading a little bit, um, more towards market driven. But the reality is, the consumer still has no idea how much healthcare costs. The bill doesn't reflect actual cost. You then run it through an insurance machine and you get another bill. It feels a little bit like playing the slots. You pull the handle, hope for the best, and you take whatever comes to you. There's some choice, but it's not based on any facts. We're still not looking at price and those kinds of things. But I think the trend is right. I think you have pressure from the retail world and the consumer world, and we're saying, hey, why can't healthcare be more like this? High deductible plans are making us more, discerning. And then I think medical interoperability is starting to get there. Some new options, like my insurance carrier has a telehealth option that they want me to go to before I see my primary care physician. So I find that to be fascinating. I think we are seeing an advent of really moving, but I would agree with you. I think it's a 3 or 4 moving in the direction of building out a market, but that could easily change. You have another election in 2.5, 3 years, and it swings back in the other direction. We'll have to see how it plays out. So here's another area I want to get into with you. So data, the article goes on. Data is the currency of these new ventures, and fintech is powering predictive analytics, fraud detection, identity management, security protocols required to compete in this modern environment. Customer intelligence will be the most important predictor of revenue growth and profitability in the fintech world, and translating those insights into personalized experience will be a close second. Without the right technologies to create meaningful, engaging experiences that exceed baseline expectations, they may soon find it challenging to maintain their revenues, especially as value-based care alters their cash flow. So data is new currency. Customer intelligence will be the most important predictor of revenue and profitability. Technology will be central to creating engaging experiences. Is this a reality in healthcare, or a better question would be, how do we make this a reality in healthcare where data is actually beginning to be used to make those kinds of changes with either predictive models or new experiences?
Yeah, great question, Bill. I think we're evolving to a data economy. I mean, it's going to be interesting. What is the output of the American economy 20, 30 years from now? Data is going to be a big component of that. And we know that those that work in the data space in many ways have a much brighter economic future than those that don't. And so I think, it's translating to a lot of different areas. When we founded Explorus, our whole premise was based upon data, and how data was the real value, and that it could in many ways bend the cost curve if used appropriately. And when I say appropriately, both morally and ethically, as well as just financially in a prudent way. But having spent a lot of time in the financial services sector, I tell you that's been around a long time as well, and they've learned some very painful lessons. The 2008 financial crisis was really all about a recognition that they weren't leveraging their data as effectively as they should have. And that's why you see now so much emphasis in fintech around things like KYC, or know your customer, the ability to predict and mitigate risk, apply AI to drive those mitigation strategies, address the regulatory requirements that are out there. And I mean, the parallels to healthcare are amazing. I spoke at an event yesterday, a fintech event yesterday, and this is what came up. And it's interesting, they actually used healthcare as an example where they need to start thinking in terms of patient privacy and protection of information and whatnot. So these markets are so interconnected. I think, I think information is absolutely critical. It's ironic that one of the major reasons why people have health issues is stress. And so they go in front of their doctor and they tell them about it, and their doctor prescribes a medication that may be needed for one thing or another, that physician in many cases doesn't know what that's going to cost the patient. it seems like a vicious circle, right? The patient gets home and finds out that their copay or that drug's going to cost them $500. And they wind right back up at the doctor's office again. So we need to think about our data. We need to put better data in front of our practitioners, better data in front of our of the patients. That's going to be critical to this, and I think the organizations that take that really seriously, again, will get rewarded with a new kind of loyalty.
Yeah. So I go in for stress. I get medication. I go home. I get the bill for the medication. I get stressed. I go back for, yeah. It's I find that know your customer thing to be very, it's a because we talked about it a lot. It's a interesting balance, right? So when you send that email to the consumer and they realize, oh wow, you know more about me than I think you know, you may have crossed the line. So there's always that balance of, we want to provide great care by knowing the customer better and being and the patient and the consumer better, but you don't want to cross that line by having information that you really shouldn't or acting on information that you really shouldn't. And there's that I guess it's an ethical balance, and it's also sort of a I don't know, a cultural balance of, how much privacy do we really think we have, and how much should we be afforded, I guess.
Yeah, I mean,
oh, go ahead.
We talk about metadata all the time, right? And big data, and big data creates more big data. One of the things that I think is going to be really important is that we have more and more metadata around the appropriate and the allowed uses of patient data or consumer data, for that matter, right? So these are the situations where I permit it being used. Here's where it's completely off limits, or opt-in models where it needs to be used. It wasn't anticipated, but it needs to be used in these ways. Am I good with it? And, again, we'll talk about it a little bit later, but that's one example of where the blockchain can show some promise.
Yeah. All right. So we're going to have to pick up the pace here a little bit. Let's kick it over to your article. Why don't you set it up and we'll talk about it.
Yeah. So one of the articles I saw this week that sort of caught my eye was an article by Brad Perelio in massdevice.com. And I've seen a number of articles that are similar like this. This was entitled 6 Reasons Why We Shouldn't Bet on Blockchain Disrupting Healthcare. And you could supplant healthcare for pretty much every other industry. And it's a fair statement. It's a fair title because the amount of hype that's around blockchain is pretty deafening right now. But the article goes and covers these 6 topics. One is that development is stricter and slower. I totally get it, right? But the reality is, in that place, the high stakes coding has always been this way for a long time. And blockchain's a nascent technology. It should get better as it matures. He also talks about things like maintenance is very costly. This is an issue with blockchain today. I think what he meant when he said maintenance, he means operating costs. But man, that is definitely the case. The power consumptions right now for the standard proof of work consensus models are just absurdly high. And frankly, they're horrific for the environment, and we need some changing. The good news is there's a lot of new technology that's on the forefront, things like proof of stake consensus models and permission models that should improve this. He also talks about how users are sovereign. And the challenges associated with getting something on a blockchain, you really can't change it after that. It's immutable for a good reason. But again, that depends to some degree on the blockchain architecture that's being deployed. This is not as much of a factor for permission networks or private networks. Talked about a forced upgrade is sometimes not an option. There's been a lot of controversy around this. A lot of times people mistakenly think that the Ethereum network was hacked last year with the DOA incident. That wasn't the case. It was actually just some bad code, but the bad code had a $50 million implication. And that community had to come together to decide what they wanted to do. And it was an interesting outcome. And then scaling. And I think scaling, he talks about scaling being really hard. Distributed computing is difficult, right? I've been doing it for a long time, Hadoop and in other environments. And I think it just boils down to the philosophy of MPP versus vertical approaches. But I think really, Bill, I've seen so many articles like this. I think it kind of misses the point, because despite all the hype, blockchain is really not the elixir for everything, and we've got to stop treating it like that. Just like internet banking wasn't the elixir, it was going to change everything about banking in the financial space. It was just another channel. I think we need to think about it in a different terms. I think hybrid models where you have on-chain and off-chain, particularly around big data and medical records, is going to be really important. And I think the real promise around blockchain, as I mentioned a little bit earlier, is really around three things. It's around medical record portability and interoperability. Certainly a lot of opportunities there. Identity management, not just in healthcare, but in human trafficking, a lot of spaces around that. It's a big issue today among our underbanked population. And probably the biggest is smart contracts. This idea that we can have a multilateral accountability in an accountable care model, right? Not just make the medical provider accountable, but also have the patients in certain conditions along the way be required, and other entities that are involved.
Yeah, so,
and controlling those incentives.
So that's a great setup. So so the nature of blockchain is distributed, immutable records, smart contracts. So I'm going to give you 5 healthcare use cases, and let's just go through likelihood of happening and impact on healthcare. So here are the 5 use cases. Provider licensing and credentialing. Do you think blockchain has application there? And then what would the impact be?
I think it has incredible potential there, and it would have a big impact. The process of credentialing is slow, it's cumbersome, it's redundant, it's expensive. If you're going to get to a gig economy in healthcare, it's absolutely critical.
Blockchain-based, HIE-based, between anyone, payers, providers, whatever, but blockchain-based HIE, what do you think?
It could be the next generation of HIE. I mean, HIE technology has struggled, right, for a lot of business reasons, but some technical reasons. So I think it's got a pretty good chance there. Not as high as credentialing, but a decent chance.
Medication supply chain. A lot of talk about that. What are your thoughts on that?
Yeah, the question is to what degree the consumers really care. I've heard a lot about this in the food industry, but then I talk to people and they say, well, yeah, if I'm generally people don't think about it. So I think it has applicability. I think it's really more regulation will drive that, though.
Okay, how about revenue cycle, and more specifically fraud prevention and auto adjudication of medical claims processing?
That's another one I think will be a big opportunity. That we all know that process today is fairly broken. It's extremely expensive. It's a big part of the cost of healthcare. So I'm bullish on that as well.
Efficient prior authorizations and referral through smart contracts.
I don't know. We'll see. I think we've got some pretty good systems in place to do that today. Maybe later, but that one doesn't come to the forefront for me right now.
Yeah. And so I think I'm telling my clients the same thing that you're saying here, which is blockchain is going to have a place. How it gets implemented is going to be important. We need to keep an eye on it. It does have a potential to be disruptive, but we're not seeing that yet. And some of these areas could be, for some systems, $1 million plays. And so that's why I'm saying, don't dismiss it, because it is at the peak of the hype cycle. There's no doubt about that right now. I mean, blockchain, replacing doctors, I'm sure, is something that's an article that's been written, but it's just craziness how hyped it is right now. And hopefully it'll come back down to earth. But while it's doing that whole thing with these emerging technologies, I just always recommend keep an eye on it, think through based on its characteristics where it can be applied. All right, so we have this section called Sound Bites. In the Sound Bite sections, I'm going to ask you a handful of questions. 1 to 3 minute answers, and we'll just start here. So a lot of people want to know this answer. So you've had a successful entrepreneurial venture in health IT. So I really have 2 questions around this. What was the one thing that surprised you as you got into healthcare, and what's the one thing you would tell someone going into this space today?
I think the one thing that surprised me getting into healthcare, not knowing anything about healthcare, was how gracious and helpful the healthcare community was particularly to me and Steve and others that didn't have experience with it, about getting up to speed. They knew that we had something to offer from data, so you have to bring something to the party. We understood big data, we understood different industries, but it is a good market to be in. A lot of really smart people that like to teach, and if you give them the respect and be patient, they'll do that. They'll coach you. They'll tell you what they need. So that is something I really do love about the market, and still do.
Yeah. So what would you tell somebody who's just starting off their health tech firm and they're going into the space, maybe something you've learned as they get started on this path?
Yeah, I think, understand the economics. That's absolutely critical. You have to follow the money. You have to understand how these models work, because you can have a great idea, great technology, but if it doesn't improve the situation for the provider, for the payer, for the patient, or at least two of those three, it's going to be a tough sledding.
Yeah, the clear message around the economics. And the other thing, I do consult with a bunch of startups, and one of the things I always tell them is we've really got to look at the sales cycle, because almost everyone makes this assumption around the sales cycle within healthcare, and it's invariably it's double it or even triple it depending on how aggressive they've been in their predictions. That's what I found.
Yeah.
So I've asked this before, but to other guests, but I was wondering from an entrepreneur's perspective, what's the biggest impediment to innovation in healthcare? And maybe what can we do to overcome it?
I think probably the biggest impediment right now is the fee-for-service model that just won't quit. And how do we overcome it? I like some of the things we talked about, Bill. I think the more we can push this market to a consumer model, the government's done some, right? And we see how easily an election can swing that. Once the consumer gears get going, I don't think there's any stopping them. We won't go back. I don't think we're going to go back from value-based care. It'll continue on its slow journey and progressive journey, but consumerism is going to be the key, in my opinion.
Great. So data science is talked about as the hottest job. Most health systems have this canon now that we've collected all this data. We have our big data platforms. Where can data science be applied? Where can we point this canon at to do the most good within healthcare today?
Well, a lot of different places. I think one of the areas that I think is really important is artificial intelligence and the development of machine learning. Data science right now is at a state where, or I should say machine learning is at a state right now where the big data that's out there still isn't big enough and it isn't clean enough. So data scientists that understand how to clean and standardize data and then write great models around it, I think are going to be in very high demand. I think that's a really big opportunity to make a big dent in the cost of healthcare and enable some pretty amazing breakthroughs. But data scientists are going to have to be at the forefront of that, and there is a lot of work to do yet.
Yeah, I can see that. So how will technology change healthcare in the next 5 years?
Well, I think there's going to be a move towards consumerism, especially as we get more data in front of them. I think the cost of care and making that more transparent at the encounter is going to be critical. And the more patients see that happening, the more they'll expect it. Again, I think the gig economy has a big opportunity in healthcare, particularly as many consumers of healthcare, especially as they get older, are going to want to have that care pushed to the edges, whether that's assisted living facilities or it's the commercial population at the place of work. And I think Gigi is a great space for that.
Great. So if you were going to do another startup in healthcare today, so you and I are going to do a venture, what areas might you be looking at?
Well, I think decision support, particularly around analytics and cost, are going to continue to be important, like I mentioned before. I do believe that we need a better operating system, if you will, to coin another term from earlier, for value-based care. I think you look at the ACO projects that have have started out there. Some of them have been very successful, others haven't. A lot of it has to do with the fact that it's hard, right? You've got a lot of competing elements, but I think you start getting some of that, those decision processes onto a blockchain, that become more transparent and more enforceable from an incentive and performance-based payment standpoint. I think that can have a profound effect on the effectiveness of many of those programs.
Yeah, and that's where you were going with Explorers, right? I mean, it's the ability to have a platform, if you will, or you keep referring to it as an operating system for that today. So, all right, well, we've gone over time, as is usually the case when I get on the show with friends who I like talking to about this stuff. What's your social media close for the week?
Well, I looked at a couple of different things that were out there, and one of them was a posting by Bill Gates on his top 5 books for the summer. And 2 of those books I thought were pretty interesting. One it's called An Origin Story, A Big History of Everything by David Christian. And it's just interesting because it focuses on societies, a lot of what we're dealing with the Unify Project, how complex they are, weaving these insights together, using this evidence. There's a lot of system and social dynamics. I've started reading this book, and it's just really fascinating. And the other book was written by Hans Rosling, recently passed away, called Factfulness. Again, focuses on understanding the truths from a data perspective, and how life, in some respects, has gotten a lot better. In other respects, has a long ways to improve, and in some cases, unfortunately, has gone backwards. But it does give a lot of hope in terms of what technology can do to turn things around.
All right, so mine is, see if this one resonates with you. A second grader said they wish cell phones didn't exist because their parents are on them all the time. So, I know, my wife is always saying to the kids, put your phone away at the table. And now they just look at her like, do you realize how hypocritical that is?
Yeah.
I hope she doesn't listen to this show. I'll get in trouble for that one. But it is true that parents are on their phone an awful lot in front of their kids. So, Charlie, thanks for coming on the show. You're going to be an empty nester. So is there a good way for us to follow you? You're going to be on social media or something more?
Yeah, I'll always be online, so you'll be able to find me, Bill. It was great being part of this. Thanks for having me on today. Great conversation.
Well, I appreciate it. So you can follow me on Twitter at the Patient CIO, HealthLyrics website, healthsystemcio.com. I just wrote an article on telehealth, and it's imperative. I think we've reached a tipping point with the VA's announcement to forego the boundaries on telehealth. Now you can see a veteran across the country. I think you could see that happen in CMS as well. And if that does, I think you'll see telehealth become an imperative for every health system. That's on healthsystemcio.com. Don't forget to follow the show at This Week in HIT and check out the website, thisweekinhealthit.com. And take a moment to follow the show on our YouTube channel. We're now up to about 130 videos, short segments that you can watch in a couple minutes, and great conversations with industry influencers. So please come back every Friday for more news commentary from my friends. That's all for now. Thanks.